So I'm here with Brenda, and we're going to be talking about death and dying and end-of-life care in the LGBT community.
Hello, everybody.
So Brenda, what stigmas do you think there are about death and dying in the LGBT community from an outsider's point of view?
I think from an outsider's point of view, it's seen as just like everybody is the same. And I think that's kind of the gist that I've gotten through nursing school. It's like, oh, treat everybody the same and everything is fine, which I think is like a good way to start with respect. But I think that there's a lot of areas of our community that have just not been addressed, which can cause like a complicated death process. So I think that like a good thing to start with here is to talk about the trans community. And the trans community, out of all of our community identities, really suffer the most with death and dying. But the average life expectancy of a person that is trans identified is 30 to 32 years in America, compared to the average heterosexual adult that can be up to 80 to 82 years.
Right.
So you think about that, that's a 50-year shorter lifespan. And that's a pretty complicated death process because of they're so much quicker. So what's making these people die off so quickly? Are they more disease-ridden? Absolutely not. It's the incidences of suicide, homicide, and just overall violence within the trans community. Within the LGBT community as a whole, people who identify anywhere on the spectrum have about a 75% chance of having a mental illness, typically depression with suicidal attempts. Out in the everyday other world, in the heterosexual community, it's about 27% of people who end up having depression. So think about that on top of that. So you have someone who's already subjected to a lot of violence, a lot of discrimination, and on top of that have depression, and on top of that have all these other housing related issues. It shows you like why they live for so much shorter. So I think that that's a really important thing to look on. And there's also the National Coalition of Anti-Violence Programs does a specific LGBT edition, and they talk about all of the violence in the community, and they release all of the statistics each year. And so for 2015 numbers haven't been released yet, but for 2014, 72% of victims of homicide were LGBT. And out of those percentage, 67 were trans women of color.
Wow.
So, right, that's a huge percentage of people who are subject to all of these attacks and this violence and assault, but it's a community that like really doesn't seem like it gets a lot of attention, especially I think in a nursing perspective. So talk about a complicated grieving process. You have in the gay community, you have not only family, if you're even connected with your family, but you have like your queer family, your family that are your friends. And if you're not even out or open or anything, how do you deal with that? So I had a friend in high school who was trans, and she ended up committing suicide, and her parents refused to use her pronouns in her obituary. They went by her birth name, her birth pronouns, everything when she had transitioned, and this is who she was. But she had committed suicide because of dealing with everything that she was going through, and her parents just like completely refused to acknowledge her identity, refused to acknowledge any of that. So us as like her friends in her community, how do you support anybody like that? Because it's like their family can't even acknowledge who they are, and their death is so sudden in the case of a suicide.
So do you think that you felt any personal bias or know of other people besides your friend you just talked about who have felt bias specifically from healthcare providers?
Absolutely. I actually did a panel in 354 in Jen Graber's class last week, and it was a panel of three of us who all identified on the LGBT spectrum, and we had this question actually from the audience, and we all said that we definitely feel like there's a bias in the healthcare field against us, because think about it, when have you been educated in the nursing program on any of these issues other than this project?
Pretty much never.
Okay, right? So I'm actually looking into an independent study right now. I'm looking at nursing programs all over the United States and LGBT issues. In the average 4-year baccalaureate nursing program, about 2 hours ever are designated to LGBT issues. So how now, as a community member, I'm going to see a healthcare provider, and I know that you're not educated at all on my issues. So how am I supposed to be open with you and what the struggles that I'm going through when you have like no idea what even my identity is or anything of that? So it's fair, right? I mean,
that's a really good point.
You know that they're educated on cardiac, you know that they're educated on respiratory, so if I'm going and talking about that, sure, I feel comfortable saying that too. But how can I bring in the multitude of personal things that go with my identity if you have not had no education on it whatsoever?
Right.
So it brings up an interesting perspective of like a trans man. So someone who's a trans man is biologically female and still most of the time has a uterus, has ovaries, has a menstrual cycle, but could have been transitioned, post-transition, 5-10 years, full beard, full masculine. You wouldn't even know looking at this person.
Right.
But they still need to see OBGYN.
That's true.
How do you have that interaction? And they're like, what are you doing here? So I think that there's definitely a disconnect and a disservice within the healthcare field in our community and trying to have that therapeutic relationship.
Yeah, I would definitely agree with you because we really don't have the education or anything as far as that goes.
I agree with you.
So then as far as a member of the LGBT community and a soon-to-be healthcare provider, like what would be advice or anything you could offer to promote like open communication and acceptance within the healthcare field?
I think it all starts with education, because how can you, and on the other side, how can we as nurses care for somebody that we don't know anything about? Mm-hmm. Imagine if you never knew anything about the cardiac system at all, ever, and then someone just gave you a patient with a cardiac disorder. You're like, I don't know, right? So social issues and gender spectrum and sexuality can fall so much under that as well. How can you care for me on a deeper level and have a therapeutic relationship if you don't know anything about me?
Right.
So I think education would be like the first step, and I think implementing more educational programs in our nursing programs across the United States would be such an easy step to at least get a foot in the door, at least like some education on anything related to it. Think about it. We take HDFS, the normal heterosexual families. We learn all about the family structure. Why don't we do that for gay families as well? There are so many women's studies courses that are even just a basic, sexuality course and learning about what is sexuality and what is gender. And learning that as like a 100 level course in the freshman or sophomore year, that can so much just open your eyes to having that experience as a senior, as a junior in clinical, seniors, and then out in the healthcare field. I think a second thing that we could do is in-hospital programs. So think about it. Hospitals do in-services all the time. They love educating their nurses. Here at UD, we have an allied training program where all professors are invited to go to. It's a one-day, it's about an 8-hour program. And the professors go for the entire day and learn everything that they can about the LGBT community. And then they have actually on their email signature, and we can look them up in the UD database, who is an ally. And that's someone that you can go to. A hospital could do a very similar program, a one-day in-service, even if it's just 1 or 2 people on a floor. Mm-hmm. And now they can have something that says, I'm an ally, talk to me, I'm open, I'm here for you. Either as nurse to nurse or nurse to patient, it would just open such a more dialect for everybody. And it's such a quick and simple program that I think could be implemented in so many hospitals. Now we have hospitals and services all around the country just for LGBT people, because we so much don't feel safe going to regular hospitals that if you look up the Mazzoni Center in Philadelphia, and there's another center in New York City that I can't remember what it is, it's an all-inclusive center. It's cardiac, it's respiratory, it's GI, it's mental health, it's absolutely everything. It gives you your hormones. So you never have to go see another straight or heterosexual person as a healthcare provider ever. You can go specifically to these centers so we feel more open and connected there. But why do we have to have those? Yeah. Why can't we have a community in the world where everyone is just accepted and understanding of what we're going through?
Yeah. So is it important for you to know that healthcare providers know your sexual orientation? I know we probably covered a good bit of that.
Yeah. I think it actually is important. I don't know as much sexual orientation as just gender identity. Mm-hmm. So most people in the United States are cisgender, meaning what their biological sex and what they believe their gender to be is the same. So someone who's born female, believes they're female, goes on she, her pronouns, cisgender. Mm-hmm. But someone who is transgender or even a non-binary gender, meaning that they don't feel that they're a she or a her or a him or, you know what I'm saying? Mm-hmm. They fall somewhere in the middle. How do we address these people? So think about, someone that's going in on a hospital intake form. Name, date of birth, never really addresses anything, where right there you can have pronouns. Right. And that can, start right there so you have that open and connected environment. They're like, hey, this may be my birth name, but this is my preferred name. These are my preferred pronouns. So you can already feel more accepted there. Right. I do think it's important to have just an overall understanding of your comprehensive patient. And it goes into that whole holistic nursing. That is, as nurses, if we took the time to sit and talk to our patients and know more about them, which is hard, when you have a ton of other things to do, it would give you a better relationship with that person. So I know for me personally, that's not the first thing I tell somebody, but think about an OBGYN health, right? Growing up, it was always do you have a boyfriend? Do you use a condom? Mm-hmm. But if that never even applied to me, now am I lying to you? Because if you ask if I'm sexually active with men, the answer is no, but you never follow that up. Right. So it kind of comes out in ways that I think is important for healthcare providers to know. But if I don't feel comfortable even telling you to begin with, then that's already a barrier right there.
Right. And it's not going to have that open communication and make you not as trustful of your healthcare provider, which is a big issue.
Right. I would want to trust my healthcare provider.
Yes, exactly. Especially as like an adolescent, like who's vulnerable to begin with and is going through other things, not knowing exactly what gender they might identify with yet.
Right. And we talked about that too, you know, as far as that opportunity with a teen is such a vital time in their place where they're really having that like gender identity and the who am I and that whole crisis there, where it's so easy to just, if you have a parent in the room, you know, can you step out? I'm going to ask your child some personal questions. And most parents will step out, and that's when you can introduce all of those topics. So if that child, that adolescent isn't even out to their parents yet, now you have that opportunity to say, hey, it's just me and you here. You can tell me what you need to. Why don't we talk about some of these things and find out who they are? And that starts that trust as a kid and as an adolescent. So hopefully as they become an adult, they can trust their healthcare provider.
Right. So it's not too much of an issue now because same-sex marriage has been legalized, but in the past there was a lot of issues with doctors not following advance directives or healthcare decision-making. So how would you feel if your significant other, a partner, whoever, was told that they could not make your healthcare decisions at the end of your life?
I can't even imagine that. Think about you spend your whole life with somebody and you live together and you maybe even raised a child together and you've been together. Most of the time in these couples and these cases, if you looked at them, they've been together for like 30, 40 years. I mean, these aren't just people that were like, hey, we're living together and we're partners. I mean, these were like dedicated couples to each other, and then all of a sudden your love is not valid. Your relationship, everything that you've done together just means nothing. And even though that the Marriage Act has passed, that's still a problem in a lot of states where, if you think about it, so maybe we're legally married, but people don't know. And I had a patient when I was in clinical that had that exact situation. It was two males that had been, they weren't legally married yet, but they had been together since they were in their teenagers, and they were both in their 60s.
Wow.
And unfortunately, the partner died on my shift. And I was talking to the husband. I was like, is there anybody we can call for you? Is there anything we can do? And he said, no, we're completely estranged from our family. We have nobody. I have nobody. That grieving process, I mean, I can't even imagine being that partner, right? So a lot of times it's just the two of you. It's not like in a heterosexual world where you have, you know, all of these support systems and all of this family. Sometimes it's literally just you and maybe a few friends, and now you lose that other half and you have nobody to fall back on. How do you grieve with that? How do you support that?
Right.
So even though that the Marriage Act has passed, there's still an issue that a lot of us aren't even out in the open in the community or to our families, and now you have that really complicated grieving process.
Yeah.
I can't imagine.
I wouldn't want to have to go through something like that, especially when you're at your most vulnerable and you're confused enough as it is trying to make these decisions, and then to be told you can't do anything about it is pretty horrible.
Yeah, I mean, I wouldn't even want to make those decisions to begin with, but then to be told that I can't even make those decisions, I think is worse than having to make them in the first place.
Yeah. All right, well, thank you, Brenda, for your time.
Thanks for interviewing me. I hope that everybody learned something.
I think we all did.